Our group focused on central line-associated bloodstream infections, also known as CLABSI. Central line-associated bloodstream infections are among one of the most frequent complications arising in patients with central venous catheters. Infections such as CLABSI result in thousands of deaths each year as well as billions of dollars in cost to the healthcare system. A central venous catheter can be placed in the neck, chest, or groin and is utilized for the administration of medications or the collection of blood. Numerous patients seen in the nursing field have central venous catheters placed in one of the previously mentioned locations. Therefore, CLABSI risk and prevention is very prevalent in current practice. The question we focused on here is, in patients with central venous catheters, does scrubbing the port of the central line after removing the disinfectant cap reduce rates of CLABSI during the time in which catheters are placed? In order to prevent CLABSI in our patients, nurses must practice proper hand hygiene before and after working with patients with central venous catheters. Nurses who specialize in the insertion of these catheters practice sterile techniques during the insertion, such as wearing sterile gloves, a sterile gown, cap, mask, and using sterile drapes. Following placement of central lines, nurses utilize proper maintenance practices, such as using a central line bundle, which includes hand hygiene, cleansing with chlorhexidine prior to accessing the line, assessing the integrity of the dressing, changing it every 7 days or before that if it is loose or soiled, and to assess the necessity of the central line daily and remove it promptly if it is no longer necessary. Should there be a change in practice? Wiping needleless connector ports with alcohol swabs following the removal of disinfectant caps will either reduce the rate of CLABSI or can cause contamination, which would increase the rate of CLABSI in patients with central venous catheters. This would need to involve a change made in the policy, procedure, and institutionally while caring for patients with central venous catheters. Our group is interested in risk management, identifying the clinical problem of CLABSI rates in hospitals, as well as the organizational standards. Currently, there is no policy or procedure stating the protocol for cleansing needleless port connectors on PICC lines. However, current practice involves the use of disinfectant caps on all needleless port connectors that are not in use on central venous catheters. Patients, infection control, and risk management would be interested in this research. While current practice is effective at lowering CLABSI rates, the use of alcohol swabs after removing the cap could either further reduce CLABSI rates or result in contamination of the port. If found to be effective, CLABSI rates would potentially decrease, and there would need to be a change in the policy and procedure of central venous catheter care. CLABSI is measured by signs and symptoms such as fever, reddened skin at the insertion site, and soreness. Intervening is measured by removing the central line. Outcomes are measured by blood tests and antibiotic usage. Measuring the effect of the proposed EBP change would be done by measuring the rates of CLABSI in patients with central venous catheters that have been scrubbed with alcohol after removing the disinfectant caps versus those that have not been scrubbed.